listening to the Compassion Fatigue Podcast with your host, Jennifer Blau. This is Session 35. My guest today is Tatiana Smith, a licensed professional counselor supervisor based just outside of Dallas, Texas. Tatiana has experience helping individuals find freedom from depression, anxiety, childhood trauma, anger, addictions, and marital issues. Her specialty is walking couples through the process of finding happiness again within their marriage, focusing on communication, intimacy, and other relationship differences. Tatiana loves seeing people accept themselves for who they are, loving themselves where they are, and being okay with not being okay. Here today to talk all about therapy, please welcome Tatiana Smith. Hey, Tatiana, thanks so much for joining us today on the Compassion Fatigue Podcast. How are you doing?
I'm doing well, Jennifer. How are you?
I'm doing all right. Thanks so much for taking time out of your busy schedule to talk to our audience about one of my favorite topics, therapy.
Yes.
Yeah. So this is a topic that I think people like us kind of get geeked out about. So I'm excited to share this with our audience. So let's kind of jump right in. So I think this is a question that, probably you get as well as I do. In terms of getting help, what's wrong with just relying on our friends and family?
You know what? To be honest with you, I think friends and family are great, but when we rely on them for certain situations that we're going through, a lot of times our friends and family can either tell us just what they think we want to hear, or either they tell us things that will get us more deeper into the situation that we're in. And they are not coming to us from a non-judgmental place. They are coming to us from knowing us. Sometimes they know the situation. And sometimes their advice that they give us is not what we need at that time. And so I think that's the main problem with going to your friends and family when you have a particular situation or a struggle that you're going through. They are not always the best to rely on when it comes to that particular issue.
You mentioned something really important. So you said the word advice. And I think that some people think that the therapist's role is to give advice. But in reality, what is the counselor's role?
In reality, the counselor's role, as far as the way that I explain it to my clients, is to help them process through a particular issue or a situation. So at the end of the day, when you come to a counselor, the main thing we want to focus on is to make sure you can process what's going on, process why it's happening, and learn how to cope, because we don't want you to depend on us. We want you to learn how to depend on yourself and how to feel confident in the decisions that you're making, or understanding why you're in this particular situation, how to get out of it, how to make better decisions and choices. So we just help you process that and maybe give you some coping techniques and skills. Every now and then we will maybe make suggestions or help you look at other options. But to give you advice and go directly into telling you what to do, that is not the therapist's role. The therapist's role is to walk you through the process.
Yeah, and I always tell my clients, I'm like, I might have a lot of education, but you know yourself best.
Correct.
Yeah.
Right. Because we're learning who you are at that time. So we're learning to build that rapport, and you're learning to trust me as your therapist, and I'm learning to trust you as the client. So at the end of the day, you do know yourself best, and you have to be honest with yourself as well as with us to help you through that process.
So Tatiana, you also have a podcast, and your audience is primarily the community of color. And I think one of your goals is to really kind of reduce the stigma within that community. But I think there's an overall feeling with the general population that, I'm not crazy. What do you say to people who think that counseling is only for, quote unquote, crazy people?
Yes. So just to piggyback on what you were saying, within the podcast, it is mainly for people of color, but the main thing is breaking that stigma. And so you do not have to be crazy to come to counseling. First of all, just what is the definition of crazy? I think there's so many definitions out there. And I know I use the term, but I use it when a friend is acting silly or being funny, or if they say something that I just cannot believe they said and they didn't keep it to themselves. And I use that term. But as far as counseling goes, you can come to counseling when you're dealing with issues such as stress, job stress, when you're dealing with parenting issues or behavior issues with a child, couples, relationship issues. You don't have to have like the world getting ready to explode in your face to utilize counseling. You can definitely utilize counseling just for anything that you're dealing with at that moment. So you do not have to be crazy to go through counseling. You don't have to have a mental illness to come see a counselor. It can be your everyday life events that you're going through, grief or anything like that, that a counselor can be helpful for, because as I said in the beginning, we are non-judgmental and we just want to help you process the situation that you're going through.
Yeah, and I mean, even therapists go to therapy.
Yes, we do. We do. And we do have to take off that therapy hat, which means we don't sit there and say, oh, well, the therapist should have said this to me. We really do need that time to decompress as well, because we have a life outside of being a therapist. And so some of the same things that our clients deal with, we deal with. We deal with grief, we deal with stress, we deal with just our personal life, and then come in as well and help people process what's going on in their lives. So yes, even therapists have therapists, and I'm a big advocate in having your own therapist, and it actually helps us with self-care too.
Oh, absolutely. And I think there's this misconception that therapists are or should be like perfect, right?
Yes.
We're still in the oven. We're still cooking. I mean, a lot of us are wounded healers. And
Hmm.
yeah, we have a lot of education. We have a lot of life experience that allows us to help our clients. But that certainly doesn't mean that we are not works in progress ourselves.
Correct. I always explain to my clients, I say there has to be something going on with me, or I have to be a little bit off to be able to sit here and hear everything that comes to us from our clients.
Hmm.
Because we sit there and we hear things that maybe the average person would be shocked about. And for us, we're not shocked about it. We kind of just go on and do what we have to do, because this is the field that we chose. So we are, like you said, we are wounded healers. We do still have some things that we need to deal with. And sometimes clients bring that out in us. Clients make us think, oh my goodness, this is something that I'm still dealing with myself. Let me go ahead and make an appointment with my therapist.
Yeah, exactly. And, just to touch on something we were talking about earlier, when we were talking about, okay, so what's wrong with relying on friends and family? Well, sometimes there are certain things that we need to share in therapy, such as grief and loss or past traumas.
Hmm.
And a lot of times, if you try to talk to friends and family, they're speechless. They don't know how to react. They may be traumatized themselves because they're so close to you. And so I think a therapist, like you said, can really act as that neutral, non-judgmental party.
Correct, correct. And I think that's what we all need, whether we tell ourselves that or not. We all need a neutral party, because it does give you a sense of feeling okay. Or it's, as I say in my podcast, it's okay to not be okay.
Amen. And so what would you say to people who say, okay, well, going to therapy is a sign of weakness. I can handle this on my own.
I don't look at therapy being a sign of weakness. And I'm not saying that just because I am a therapist. I actually think it takes the strongest person to realize that they need help, to call and find out how they can get that help, and then set up that appointment with that therapist and go through with it. I think it takes a lot of strength to do that. So I do not feel that therapy is a sign of weakness. I definitely think that it takes a strong person to be able to do that. And so I want people to to lose that thought process that it's a sign of weakness, because it definitely is not.
I totally agree with you. I mean, you have people out there that, stuff it down. Maybe they turn to alcohol and drugs. And you're right. It really is a sign of strength, a sign of courage to be able to say, we all got stuff, right? And to be able to
Mhm.
say, I'm going to deal with this. I'm going to confront this demon and I'm going to deal with this stuff. That takes a lot of bravery.
Yes, it does. It does. I mean, just think, even talking about it right now, if you just like how we just broke down what people have to do, that takes a lot. That first step is, I think, very strong.
And so, what are some of the signs that, maybe it is time to seek the help of a professional?
So, some of the signs that I tell people to look for is if all of a sudden you're feeling sad, angry, or otherwise, you would just say, I'm just not myself. Like, you can feel when something has changed and you're not yourself, you're not your normal self, you're withdrawing from friends and family, you're not talking to people as much, you find yourself staying in the bed more, not wanting to get up and be active like you normally are. That is, definitely a sign. Another sign can be if you're starting to drink more than normal or starting to drink at all, if you're eating food more than normal or not eating as much. Also, sex, most people don't know, but sex can definitely be a sign. If you are being a little bit reckless with your sex life or doing things that is not normally what you would do sexually, that can be a sign, as well as using drugs. And it's just all about not having control over what you're doing. You can also have signs like if you've gone through some type of grief. We feel like we're supposed to know what we're supposed to do during those times. But if you've never dealt with grief before or never had to grieve, then you don't know what to do. And that's a sign something traumatic has happened to you. That could be anything from getting into a car accident to, a domestic violence situation, or even seeing something that's traumatic. That can be a sign that I need to reach out because I don't know how to handle all of this. I am overwhelmed. I have sensory overload because all of this is happening. Let me reach out to someone and, get some additional help, because those are signs. And something as simple as shopping too much, spending money that you would not normally spend, having highs and lows in your mood and your attitude. Those are also signs that it's time to reach out for some assistance.
So it sounds like what you're saying is basically anything that is interfering with your quality of life may be a sign that it's time to talk to someone.
Correct, because you know what your norm is. And so the minute that you feel like that norm is off to the point where you have no control over it and you don't know how to get it back, then yes, that is definitely a sign to go ahead and reach out for some counseling.
Okay, so people might be thinking, okay, I'm ready to go get some therapy. So I'm looking on psychology today, and we got psychologists, we got marriage and family therapists, social workers, licensed professional counselors, psychiatrists. This can be overwhelming, right? So, what
Yes.
is the difference between a therapist and a psychiatrist?
So I'm actually going to start and go backwards. So the difference between the two, a psychiatrist has gone to medical school. They are actually considered medical doctors, and they have the right to write prescriptions, as well as they have studied the psychotropic medications. And psychotropic medications are going to be the medications that we use for mental illnesses or some type of mental issue. So the psychiatrist is the one that can prescribe your medication for anxiety, panic attacks, mood disorders, schizophrenia, major depression. They are the ones that you will go to see, and they will talk to you about what's going on. And based off of that conversation and that assessment of questions, they know what medication is best for you to be on, the dosage, and everything. A therapist is who you would go to talk about everything. So your psychiatrist is not going to get deep into what's going on with you or what situation might have led to you feeling like this. Like I said, they just they get enough information so that they can know which medication is helpful for you. The therapist is the one that goes into what is the situation you went through, what has changed in your life that might have led to this situation. Sometimes they do go into your childhood, but not all the time. So a therapist has gone to school, they have received a master's degree, whereas, as I stated, the psychiatrist actually went to medical school. So the therapist has a master's level degree, and from there, they are then licensed within their state. So I am licensed within the state of Texas. You have some hours that you have to deal with and or go through, should I say, and then from there, they do more talk therapy. So they are the ones that help you through the process of what's really going on and how can we figure out the best way for you to cope or the best way for you to change that situation, set boundaries, get out of that situation. And if both are needed, a therapist can refer you to a psychiatrist to help you get on the proper medication, which in turn, talk therapy can be really great with the two. You have a higher success rate if you need both of them. You have a higher success rate of doing both than just one or the other.
And so it sounds like the word therapist is an umbrella for social workers, licensed professional counselors, psychologists, and marriage and family therapists. They're all essentially just different degrees, different licensing boards, but they all provide therapy.
Yes, they all provide therapy. And so, yes, it is, like you said, it is under an umbrella where all of those fields do fall under. And it's just different degrees, like you said, and different licensing boards. And one might focus a little bit more on family and marriage, like a licensed marriage and family therapist will focus possibly a little bit more on marriage and family concerns, whereas a clinical social worker or a licensed professional counselor will focus more on individual needs and, depression, anxiety, and things of that nature. They might not focus strictly on just marriage and family.
So speaking of better living through chemistry, why can't I just take meds?
Because medication is not always, it's not an end all be all, and it doesn't fix everything because you can be on medication, but you still have your situation, you still have your problem, you haven't dealt with the issue. And so therefore, medication might just make you feel better. It might take your high from a out of control high to a just midpoint, or it might take your low to a just midpoint, but it doesn't deal with why you got to that space.
So it's almost like putting a Band-Aid on. You got to deal with the
Yes,
original wound.
right. You still have to deal with the original issue. It doesn't make you heal. It just, like you said, just covers it up, makes you feel better for a small period of time.
And oftentimes, sometimes we will refer clients to their primary care physician or a psychiatrist to get medication to get them to a point where therapy will then be more effective.
Correct, because sometimes, depending on what they're dealing with, they can't even focus at that moment to be able to express how they're feeling and what's going on inside. And so, yes, at that point, we could, like you said, suggest that they go to their primary care physician or their psychiatrist to help them get stable enough to then be able to get to the point to talk and start to process on what's going on.
So let's talk a little bit about that process. So let's talk about the therapeutic process. So, for people that have never done this, what do sessions look like? How often should you go? I mean, what is this whole mystical thing of counseling?
Well, our average session, what it generally looks like is if it's your first session, and I'll speak personally from how I do it because every therapist does it different. So for me, if it's a first session with a client, what I do is I reintroduce myself to them. And the reason why I say reintroduce myself to them because they have already either been referred to me by a friend, which has told them some things about me, either they found me through my website, which means they've read some things about me, and even if they chose to go through their insurance, at the same time, that means that they could have read something about me from their insurance panel, or even if they called their insurance, they gave them a little snippet of something about me. So I reintroduced myself to them, who I am, my degree, my background, I go over confidentiality policy, my private practice policy, so they will know, what to look for. And then I do something different. I actually give them a little personal information about me just to make them feel comfortable, to understand we're trying to build rapport. So if I'm getting ready to have you open up to me and give me information about you that could be secrets that you've never told anyone else, I want you to feel a little bit comfort about who I am. So I give them a little personal information about me. So, where I originally was born and raised at, where I live at, as far as the city, so they can say, okay, she does live in the area somewhere. And then I do talk about sports a little bit because that's what I enjoy. And then I do let them know that I have a dog and that's my fur baby and how much I love her. And then from there, I go into, tell me a little bit of what brought you to counseling. What made you feel like now is the time to come and see a therapist? And then I also ask, what do you want to get out of counseling? What do you want to see different in your life? What do you want to change, or what do you want to learn in the process of coming to see me? And so that's generally how my first session goes. And we also discuss, how often do you come to counseling? Generally, I like for my clients to come and see me once a week, but there are some that come that are in such a crisis mode that we need to start twice a week, and then we can decrease. And then there are some that they can come and start every 2 weeks. So at that point, that's where I, as the therapist, make the assessment of what's best and how often they need to come.
And I think, that's important. It really is different for everyone. People will say, well, how long is this going to take? You really can't answer that. But I always tell people, the more work that you put in, the more you're going to get out of it. And I also tell them that my job as a therapist is to work myself out of a job with you.
Mm-hmm.
So, I mean, you don't want, this is not psychoanalysis where you come, 6 days a week for 3,000 years. It is, generally once a week. And then, as you start making progress and reaching your goals and are feeling more stable and able to tackle some of these problems on your own, then we start kind of weaning you off, every 2 weeks, once a month, once every 3 months.
Right. Yeah. And I think that's so true what you said, is that I am basically trying to get you to a point to where you don't need me anymore. You don't need me anymore. And that's perfectly fine, because that's how this process goes. Because that means you're to a place where you can say, I can use what we discussed and I can start using it on my own and start putting it to use, to where I don't need you anymore. And from there, I do what I like to call maintenance sessions, which is the same thing we do with our cars. After so many, miles, we go in and we get maintenance on our cars. I tell my clients it's the same thing. And so generally when we get to that ending point, I might schedule an appointment to see them for, another 2 or 3 months. And it's just maintenance to just say, hey, how's it going? Is everything still going well? And I do check on them sometimes periodically in between. But yes, the point is for you to not need me anymore.
Yeah, and I do the same thing. I always say, okay, we're not done. We're done for now. And,
Correct.
you're always welcome to come in, and I call it a tune-up session,
Yep.
But you touched on this earlier too, I think, and all therapists work differently, but something I really like to incorporate into all of my sessions, I like to give clients, well, I call it an imaginary toolbox. And, I say, I'm going to help you learn some different coping skills, put them in your toolbox, and then by the time you leave here, I want you to have a full toolbox. So whether that's ways to deal with depression or anxiety or stress, I want you to leave therapy, at least with me, with a full toolbox of coping skills. And then you can determine which ones are most effective for you as you move on from therapy.
Correct. And I do the same thing. I do have them have a therapy toolbox, like you said. And sometimes in the middle of sessions, they'll write something down and say, oh, this is good. I'm going to keep this. I'm going to remember this. And so I think that's a great thing. And I think it's a great idea to have, because, like you said, you can reach back and you can utilize those things for later. And you can catch yourself and say, okay, I know I discussed this with my therapist. What was it that we did? And then you can pull that back up and then use it for yourself later.
And so, if people are ready to go to therapy, I think another issue they could run into, which may cause some confusion, is this whole difference between using their health insurance versus private pay. Can you
Mhm.
give the audience some, I guess, some pros and cons of each method?
So, yeah, so the pros and cons. So, let's go through the pros first. So, the pros of using your insurance is that this is something that you already paid into. Basically, you pay it out of your paycheck or however every month. And so, generally, depending on the plan that you chose, you can come and see a therapist for your copay, and your copay can be anywhere between as low as $10 all the way up to maybe $50. And that's just the only thing you have to pay every time you see your therapist. And then they can go ahead and the insurance will cover whatever the remainder is. So that is definitely a pro. Another pro is that your insurance company does not just let any therapist on their panel. They look up some things about them. They do make sure that the therapist's license is up to date, their insurance is up to date, that they have not had any dings to their license, which means that they have not gotten into any type of issues or trouble with the licensing board. So the insurance company does make sure all of that is up to date. And so therefore, that the therapists that are within the panel on your insurance are pretty much A1 when it comes to doing everything correctly with the licensing board. The pros to private pay, and this is also going to be a con as well. So this will be a con for insurance, but a pro for private pay is that you do not have to send anything to your insurance company. So when I say that is if you're private pay, then you and the therapist have the understanding and the relationship, and that's it. Whereas if you utilize your insurance as a con, that the therapist has to diagnose you. They have to diagnose you because that's the only way that the insurance will cover it. And when you do private pay, the therapist does not have to like write down a physical diagnosis to be turned into someone. And you don't have to worry about your medical records or anything of that nature is something being put on your medical records that you might not want to. So that's definitely going to be a pro for private pay and then a con for insurance.
So that's also a confidentiality issue.
Yes, that gets into confidentiality, which if you do private pay, strictly confidential, and that's it. When you go through your insurance, the therapist does have a right to have, you and the therapist as far as confidentiality. But if insurance asks for certain things on your record, we have to give it to them because as a therapist, we signed into a contract with them and they say they have the right to audit your records. And when they audit your records, they have the right to see what's in there. And that's because you chose to go through insurance. Whereas if you choose to go to private pay, they don't audit your records. Like your records are just between you and the therapist. The con though for private pay is that you have to pay whatever the therapist rate is out of pocket. And the therapist might be too expensive for you and that might not be something that you can afford, and I can understand that from a financial standpoint. But then again, I always ask people, but how much is your situation, or even your at that moment, if you feel like I don't have my sanity, how much is your sanity worth for you? Is this something that you can look at putting into your budget? Because I think we just as people, we spend money on things that we didn't budget for. We just do it. I know I do it in the grocery store all the time. It doesn't even have to be anything luxurious. It could be something as simple as I did not stick to my grocery list. I added more things in my basket. I didn't budget for it, but I can cover it. So how much is your mental health and your mental wellness worth to you? Also, if you have an HSA with your company, then that's money that your company has paid in. And that's also money that you tend to pay in as well, like every paycheck or every pay period. And so you can also use that as your private pay. So I do have clients who don't go through their insurance, but because they have an HSA that's through their company, they utilize that card and pay out of pocket. And so therefore they don't have to worry about any of those things I said insurance wise.
And that's health savings account, right?
Yes, that's your health savings account. Yes. And that's actually something that if you choose to leave your job, that you can actually take with you and continue to pay into. That's not something that if you leave the company that they take from you.
Okay. And so I've heard from a lot of people that, especially my audience members, they deal with such trauma, be it animal cruelty or euthanasia. And I've heard from a lot of personal clients that they feel like they have to almost edit themselves because they're afraid of traumatizing their therapist, or they tell me, I had a therapist and I made her cry. I always say, if you have to hold back, then you're probably with the wrong therapist. What is your advice to people who say, gosh, I've tried counseling before and I ended up therapizing my own counselor?
I think I would probably say to them the same thing that you say. If you feel like you have traumatized your therapist, or if you feel like you have to hold back or edit yourself from your therapist, then that is not the therapist for you. I believe as therapists, we are trained to expect the unexpected. Basically, as therapists, we never know what we're going to get. And I would never want a client to feel like they cannot tell me something because they're concerned about my feelings. And so I let my clients know, don't worry about my feelings. Don't worry about what I'm going to think when you say something. That's for me to learn how to handle my emotions. That's not for you to be worried about. And so as therapists, I think that's why self-care is so important, because we do have to learn how to prepare ourselves for anything that might strike us as a shock or an emotional jolt. We have to be prepared on how to handle that. So I don't think a client should have to edit themselves at all, especially, yes, animal cruelty is something that is horrific. And I know even if I'm watching a commercial, sometimes it might make me uncomfortable and want to turn. But when it comes to my profession and something that I signed up for, then I have to learn how to deal with it. And then once they leave, I have to learn how to decompress. If that means calling another therapist and say, hey, I just had this client. This is kind of what they talked about. I just need you to help me process it. And that goes back to what you were saying, having your own therapist as a therapist, or even having a peer group, someone that you can contact or a group that you could contact to kind of just go over what was just said or heard so that you don't take it home with you. So I don't think a client should ever edit themselves. And if they feel like they're making that therapist uncomfortable, then to me, that means find another therapist. And that also means interview the therapist a little bit better. So that means if I come in and I deal with animal cruelty, and that's probably the main thing I'm going to be talking about. Is that something as a therapist that you think you can handle? Do you have expertise in that area? Or how will you handle that? It's okay to do that.
I think that's excellent advice. And I would just add that, what you said is really important. It is not up to the client to take care of the therapist. If the therapist feels triggered during a session, that is up to your therapist to be practicing his or her own self-care, to be getting their own therapy, and to work through their own stuff.
Correct.
I would just add to that, and I'm curious to see, what your opinion is on this. But for my audience members, I would highly suggest, I'd like to say, oh, go find a compassion fatigue therapist, but we're a handful in the United States, to be honest with you.
Okay.
But I would say, if you can't find a compassion fatigue therapist, I would recommend finding a therapist that deals either with grief and loss and or trauma, because I think that those therapists are going to be better equipped to deal with some of the issues that you might want to bring to session.
And I completely agree, because that's exactly what it is. Even though it's an animal or it's a situation with animal cruelty, it is a loss. It is a loss, and you do grieve having to put an animal down
Mhm.
or rescuing an animal that you know you rescued from a bad situation. And so the possibility or the likelihood of them surviving is very low. And you have to deal with that. You have to accept that. And so I do think that is a loss. And if you're rescuing them from a situation that is horrible, just like horrible, where a human or an animal should not have to be in that situation, that is traumatic. So I think, like you said, referring to a therapist who has dealt with those type of things, I think would be great, because I think they would be open to the situation. And that might even be the time where you can ask the therapist, do you have an animal yourself? Because they can be more compassionate because they have an animal. So they know what that will feel like. They can actually think about, oh my goodness, what would that feel like if I had to do that with my dog, or if I had to rescue a dog from that type of situation, or a cat, or any other type of animal. So I think that's another question that you can probably add in is, do you have any pets of your own? Because that can also let you know what their compassion level is going to be like, when you deal with that, when you tell them what the nature is that you're dealing with.
I completely agree with that. You do have every right to ask your therapist questions, whether it's their values or now keep in mind that the therapist, we're taught in school, don't disclose anything about yourself.
Right.
However, you do have a right, if the therapist hates animals, you have a right to
Mhm.
know that. And also, if you are in the middle of session and your therapist does not validate your experience as grief, as a loss, as being traumatic, if your therapist tries to pathologize, that is to say, they're trying to almost treat your experience as not being valid, get up and walk away and find another therapist.
And that is correct. Because at the end of the day, this is your session, this is your process, and you are in control of it.
So, what is the best way to go about finding a therapist?
The best way, I think, to go about finding a therapist, first and foremost, for me, word of mouth is always best, because nobody's going to tell you about a bad therapist that they had. They're going to, if they're open with you that they're in therapy or they've seen one, they are going to be honest with you about the therapist, and they are going to tell you, things about the therapist that you probably want to know before you even get there. So I think word of mouth is going to be always the best way. The second way, I think, is you can always find a therapist through your insurance panel if you choose to go through your insurance. Another thing, and I think you mentioned this, Jennifer, just in the conversation, Psychology Today is a very good avenue to use. And, it's online, so you can look that up in the privacy of your home or on your phone or wherever you are. Another good avenue is, if financially there's a struggle, then the other option is going to be Open Path Collective. And that is a membership, but you are guaranteed to see a therapist for between $30 and $50 at the most. And $50 is going to be at the most, and the least will be $30. There are some therapists who choose to do sliding scale, and that means that there are certain days and certain times that they see clients for a lower rate than normal. But that information you can also find on Psychology Today. And if you're a minority and you're looking for a counselor of color or a counselor that's more from your cultural background, you can also look at a good avenue that I've been sending people to is Therapy for Black Girls. And they have therapists in every state. And you can go and look just based off of the state you're in, and they can go ahead and assist you with locating a therapist. And generally, on all of these sites that I've listed, except for insurance, the therapist has their information. So you will know where the therapist is from, where they got their schooling. You will find out what type of therapy they specialize in. So that means, is it trauma? Is it grief? Is it depression? Is it helping someone through job stress, relationship? That all of that information is on there, and kind of what is their style of therapy as well, because everybody's style is different and everybody's style is not for everyone.
Yeah, and I would just add that, and by the way, I'm going to add all those links to the show notes page at the compassionfatiguepodcast.com. And I would just add that people say, oh gosh, well, this person's psychoanalytic and this person's CBT and this and that. Really, it comes down to the therapeutic relationship. So what they found through studies is it's not so much the technique, but about the relationship.
Correct. Yeah. And I just base it off of my client. I don't really go through the whole CBT and all of that because nobody's going to really understand that or solution focus. I just base it off of what my client needs at that moment. And that helps me choose what's the best route for me to go as far as a therapist. One thing that doesn't change with me is I'm very direct with my clients. And so that doesn't change. I might not be as harsh with some if they're like people pleasers or if they're emotional. So I'm not as direct, but that's the one thing that I am pretty much across the board. But like you said, it really depends on the therapeutic relationship that you have with your client and with your therapist.
So, Tatiana, you touched on this a little bit earlier, but tell us a little bit more about your new podcast and how people can learn more about you.
Okay, so I have a podcast that is called Talking Off the Couch. And yes, it is a play on words because most people feel that therapists have couch in their office and you all come and you lay on our couch and you tell us your problems. So my podcast is a play on that. So it's called Talking Off the Couch. It focuses on mental health and mental wellness within the communities of color. And the main purpose is to shed light and break stigmas about mental health and wellness within the communities of color. So what is found is that a lot of times within communities of color, there's a stigma that says, do not go to see a therapist. You don't need to go tell your business or your problems to anyone. Kind of like what we led to or talked about, it is a sign of weakness. You should be strong enough to figure it out on your own. Or if you go to a therapist, you're crazy. So I just want to flip that, especially within the communities of color, and put it out there that there's nothing wrong with speaking to a therapist. It does not mean you're crazy. It does not mean that you're weak. It just means that you need some additional assistance to maybe deal with something that you've never dealt with. And I also want to start talking about it more because it's not really talked about as far as mental illness. So depression, anxiety, bipolar, post-traumatic stress disorder, those are not talked about a lot within the communities of color. So when people go through it, they have no idea what it is. And I think that's why they feel like it's craziness or things like that. So the podcast, I release it every Thursday and it can be found on iTunes and Google Play. And you're free to email me at info@talkingoffthecouch.com if you just have any questions once you listen to the episodes. And I do respond back to that. And the website for that is www.talkingoffthecouch.com. And I just want everybody to understand that it's okay to not be okay. So that's kind of the slogan also for the podcast.
And Tatiana, do you have a private practice website as well?
I do. So I do have a private practice within McKinney, Texas. So that would be considered a suburb of Dallas. And that website is www.tsmithcounseling.com.
Fantastic. I will put all of those links up on the show notes page at the Compassion Fatigue podcast. Tatiana, thank you so much for taking the time out today to talk with us. I appreciate it.
Thank you so much for having me. I've enjoyed having this conversation with you.
Take care.
Thank you. Take care.
Thank you for listening to the Compassion Fatigue podcast. Remember to head on over to iTunes and subscribe to the show so it's automatically downloaded to your mobile device and you never miss a single episode. And don't forget to check out the CompassionFatiguePodcast.com for more great resources, including information on our new upcoming Rescue Me retreat. Please note that this podcast is not meant to provide medical advice or substitute for psychological care. Please consult with a mental health professional if you need additional support. And if you are feeling suicidal, please go to your nearest emergency room or call 911.